Hi everyone, this is Dr. Emily Howell from Ashbridge's Health Center. Today I'm going to talk about running injury prevention. This is usually a talk I do for the running room and some local gyms just to help people in the spring as they're about to get outside and get fresh air, and how to basically prevent having to stop as soon as you've started from overdoing it. So I have seen a lot of people out running, and I'm really excited to see people getting outside, getting fresh air, helping their physical as well as their mental well-being. But there are some tips you can do to help prevent injury while you're excited about starting. So the one disclaimer is, remember, not all this advice is applicable to everyone, so please talk with your healthcare professional to see if it's right for you. So the first rule I have is the 10% rule. This is fairly common, a lot of us talk about it. You don't want to increase your intensity or duration more than 10% at a time. Basically, your body tissues need time to adapt. So if you throw too much at it, too soon, too fast, too long, you'll get hurt. The next one is adequate rest. So you also want to rest between 24 to 48 hours between each running session. You can do something else like Pilates, yoga, weight training, that kind of thing, cross train, but you don't want to do the same thing over and over because that can lead to repetitive strain injuries. You want to stretch frequently because long muscles are stronger. So what you want to do though is do it after a warm-up. So either a nice quick walk or an easy jog, about 5 minutes or so, and then stretch, or do it after you've done your run and your cool down. The key is that I always explain it like it's an elastic band, and if you pull the elastic band out of the freezer and then stretch it, it's more likely to tear. It's more brittle, but if you give it some time to warm up, about 5 minutes, and then stretch, it'll have much more plasticity, so you're less likely to injure yourself. You want to avoid running more than 72 kilometers per week. They've shown that any more than that does not help with your performance and actually leads to more injury. So 72 kilometers is sort of the max they recommend per week for performance and injury prevention. You want to change your shoes every 500 to 700 kilometers. Seems like not that much, but the shock absorption and the support of the shoe can be reduced after that point. Even if you've worn them inside and they look pretty, the biggest test I always say is go to the store, try them on, or order them online, and you put the new ones on compared to your old ones, and you'll notice a massive difference. Keep in mind, not everybody likes a very cushioned shoe, and that's okay. Wherever you're at, if you like a minimalist shoe that works more on the intrinsic foot strength versus a more supportive shoe, whatever you're used to, go with. The other key is that even if you've been buying the same shoes forever, often the companies will change. I had this a few years ago. I've been buying the same shoes for a really long time. I got a new pair, and all of a sudden I had to go up a half size. They'd made the toe box smaller. And then last year, when I went to get the same one, I had to go down a half size because so many people had complained that the toe box was too small that they put it back to its original shape. So keep an eye on that. And you want to make sure you have a wide toe box to give your feet some room in the forefoot. The other thing is get a shoe that's according to your foot type. So there's pronators that heel strike on the outside and roll in, and supinators that roll on the outside and then neutral. About 80% of us are pronators, the rest are neutral or supinators. So make sure you get assessed for the right shoe because you don't want to have something forcing you in the wrong direction, which can lead to pain. You also want to eat a balanced diet. So make sure you're getting enough fat, complex carbs, and proteins, whatever mix that you prefer, but make sure you have the right fuel because that will help you sustain you through your running session and also help you recover faster. You want to stay hydrated. About 1 cup of water for every 20 minutes of activity. I always say by the time you're thirsty, you're already dehydrated, so we need a lot more water than we think. You want to strengthen your stability and postural muscles as well as your legs. So weight training for your legs is great, but you also want to have everything else that's supported around your torso as well, because general strength throughout will help you perform better and prevent injury. You want to have a network of healthcare practitioners, so chiropractor, massage therapist, physiotherapist, sports med doc, acupuncturist, naturopath. You want to have a team of people that can help you optimize your performance as best as possible. And finally, my favorite, you want to deal with your injuries sooner rather than later. I always say pain is a message, and it will keep screaming louder and louder until you listen. So a little murmur is okay, but if it starts yelling at you, definitely pay attention to it, because the sooner you get it treated or dealt with, the less likely it is to impair your training. We want you to be able to have all spring, summer, and fall to run, and if you hurt yourself right off the bat, you won't enjoy the season as much. So our general rule of thumb for treatment for any injury is, we used to say RICE, rest, ice, compression, elevation. That's sort of going out. There's always a contrast between ice and heat. I always say ice is for the first 48 to 72 hours, 10 minutes on, 10 minutes off, 10 minutes on, and then after that you can add heat. I also like Epsom salt baths or contrast baths, but you go with what feels good for your body because every body is different and there's research for both sides. You definitely want to modify your training if you're having pain. You can cross-train, do other things. A lot of my runners, I tell them to do deep water running while they're having an injury, but obviously we can't do that right now because the pools are closed. But the keys of when to seek help of a healthcare professional are swelling, discoloration, popping or clicking, loss of function. You can't bear weight on your ankle, knee or hip. The pain is getting worse and not getting better. And if the pain is more than a week after applying all the self-care and it doesn't get better, definitely seek out some help. So we are available by phone or virtual care. We're here to help. So please let us know if you're having any issues. And thanks for watching. I appreciate all your attention and I hope everybody is well. Thanks so much and have a great day.